Here's what most of us don't realize: stress is contagious, not metaphorically, but neurologically. When one family member's nervous system gets stuck in fight or flight mode, it creates a ripple effect that impacts everybody in the house. The baby picks up on dad's work tension, the toddler mirrors mom's overwhelm, even the dogs start acting differently when the family stress peaks. Now, sometimes we try to fix individual problems, and this is really how we've grown up in American culture. We think more individualized instead of as a family. Anxiety medication for mom, sleep training for baby, behavior charts for the 5-year-old, but we're missing the bigger picture. You can't heal in isolation when you're neurologically wired to co-regulate with the people you live with. This video is for parents who notice that when one family member struggles, everybody struggles. For families where dad's work stress somehow affects baby's sleep, where mom's anxiety shows up as toddler tantrums, and where holiday gatherings leave everyone exhausted for days. You're not imagining these connections, they're neurologically real. So you'll discover how family nervous systems literally synchronize with each other, why caring for just one person rarely creates lasting change, and how something called co-regulation explains why your stress becomes your kid's stress. Most importantly, you'll understand why neurologically focused chiropractic care for the whole family isn't just helpful, it's essential for breaking generational patterns of dysregulation. Now, we always start with a little bit of research. Research shows that up to 15% of infants experience regulation difficulties in their first year. But here's what that stat doesn't capture. Those babies are usually born into families where parents are already dysregulated. We see this pattern every week in our practice here at 3T. Stressed parents bringing in struggling kids, not realizing their nervous systems are connected like a Wi-Fi network in the same house. The data gets more compelling. When mothers experience chronic stress during pregnancy, their cortisol levels can directly program their baby's developing nervous systems, and that baby grows up with a nervous system that's pre-wired for stress. They become those anxious toddlers and kids, then the stressed adults who have babies of their own, and then that cycle continues. We're sharing our nervous system patterns, and that's what's being passed down. We see this all the time, day to day, where there's a lot of different co-regulation where babies feed off of their parents and vice versa. And this is where we get into a lot of our scans here. When we look at co-regulation with HRV, HRV is heart rate variability. It shows us where we see total energy in the nervous system, but also where it is on a scale of that fight or flight, sympathetic kind of protection mode, versus what we call the brake pedal or the parasympathetic vagal tone, which is our typical rest, digest, and restoration of our nervous system. We've all been in a situation where we've been in an environment, whether it be work or a family holiday, where somebody is feeding off that tension in the room. We all kind of see somebody that's stressed out. We all kind of bundle up and get tight. We all feed off of that energy that person has been putting off when they're stressed out. Now, the same thing happens at home with families. When we see mom, dad, or baby struggling, not sleeping well, nobody's sleeping well, we all kind of co-regulate through mirror neurons, through breath rate, through heart rate, and we see those HRVs match up. So when we look at some of these patients here that are all in the same family, we see their HRVs typically stack very similarly. We can see on the left side a little more sympathetic, but both the middle and the right family member are hovering in that same yellow zone, trending towards that more sympathetic tone. Now, typically the green box is kind of where we want things to happen. We want equal balance. We need our sympathetic nervous system. We want that fight or flight to kick in when it should kick in, but we need that rest and digest to restore afterwards, to regulate, and to basically give us energy back in the nervous system. So when everybody starts trending to that left and starts trending into the red or the yellow, that's when we get exhausted, we feel burnt out, we feel like we're constantly on edge. We've had big reactions to small stressors because we don't have that battery level and we don't have that parasympathetic activity to get the adequate rest and digest and restore in our nervous system. And that's basically the science of family co-regulation. Our nervous systems don't operate in isolation. It's constantly reading and responding, just like these graphs here, to the environment that they're in. And that's what co-regulation is all about. It's just like a air traffic controller coordinating multiple planes at an airport. Nervous systems are trying to coordinate with every other nervous system in your home, and especially that out in the public when we're at work or whether we're at school. And that's why we see kids that are especially tuned into their parents' nervous systems, their friends' nervous systems, their teachers' nervous systems. And that's why co-regulation is so important at home, because that's the most amount of time that we spend around people typically. So even when mom's heartbeat from across the room, dad comes home stressed from work, all the nervous systems in the entire family can shift towards that sympathetic dominance or that fight or flight mode. And a lot of times it can happen within minutes. And that's where a heart rate variability is great to track. Studies using heart rate variability measurements show that family member stress patterns often synchronize, and that creates that cycle of calm or a storm of chaos. And that's why individual care can sometimes fall short. Caring for mom's anxiety while dad stays dysregulated, it's like trying to remodel a house on a cracked foundation. We can't build and kind of grow as a person on an unstable base. So sending your child to therapy while the home environment stays stressed is like pushing a car with the parking brake on. Progress can go, but it's going to be slow and it's going to be frustrating. And a lot of times there's going to be regression backwards at some point, or we're going to hit a glass ceiling. And that's where we work with a lot of OTs and PTs and speech therapists and the like, because a lot of times when we can get families' nervous systems working together and get that child's nervous system working efficiently, we see so much progress with their other therapies. And that's why the perfect storm isn't individual. It can be generational, it can be environmental, it can be collective, affecting everyone under the same roof. One family member getting adjusted is like having one instrument tuned in an orchestra where everyone else is off key and that discord remains. When your nervous system is like a computer, it has too many tabs open, it's going to slow everything down. We've all been through a lot of these scenarios. And so the neurological path forward, when families see a neurologically focused chiropractor together, their HRV patterns begin to synchronize in a healthy, balanced way like we looked at before. And that's when families create called that regulation field, where everybody's nervous system supports rather than stresses the others out. Breaking that generational cycle requires addressing the whole family system, not just the identified patient or the diagnosed kid or the diagnosed parent or the ones that's just showing those symptomatic signs. Just like the umbilical cord that connected mom and baby, your family stays neurologically connected, and healing happens best when you heal together. So instead of just surviving the chaos, we can start transforming it. Families, it may be time to schedule boost adjustments as we head into the summer if you're a current patient. And if you're new here or your child is under care, but now you're interested to see your scans, click the link in our bio, comment below, send us a message. You can get a hold of us in a lot of different ways. Your family deserves better than survival mode.